last 24 hours, we have identified 1,980 new cases of COVID-19 and completed about 5,000 tests. Our positivity rate for lab-confirmed cases was very high yesterday at about 40%, although our 7-day average is slowly declining. Our hospitalizations for COVID-19 may be beginning to plateau, although it is important to note they are still currently higher than at any other time in the pandemic. There are currently 1,585 people total with COVID-19 in hospital, which includes 109 in the ICU. Sadly, more Albertans continue to lose their lives to this virus. Over the last 24 hours, 13 new deaths have been reported to Alberta Health. My sympathy goes out to the family and friends of these individuals and to anyone who has lost a loved one, no matter the cause. Another tool in our fight against COVID-19 is rapid tests. And I'm pleased to share this week that more than 3.1 million rapid tests will be sent to First Nations communities, pharmacies in Calgary, Edmonton, and Red Deer, and Alberta Health Services sites in other parts of the province. You can check the Blue Cross website that lists which locations have rapid test kits available. When you find a site that does have tests, simply bring your ID and Alberta Healthcare card to receive a free kit. In addition to these tests for the general public, the second mask and test shipment for schools started last week, and approximately 1/3 have already gone out. With respect to COVID-19 impacts on schools, Alberta Education has provided the following update. As of January 31st, 22 of the more than 2,500 schools in Alberta have shifted to temporary at-home learning to address operational challenges, which means less than 1% of schools are currently operating online. 6 of these schools have less than 40 students in total.
I've said before, once we begin to see a sustained reduction in COVID pressure on the hospitals, I am looking forward to being able to make decisions about moving towards relaxation of public health measures at that time. And I believe that will happen this month in February. We need to see a sustained decline in hospitalization pressure, but with the overall trends, I am very optimistic that we will be able to move forward with meaningful relaxation of public health measures this month, including the elimination of the restriction exemption or proof of vaccination program. So I just ask people to be a little more patient as we are still at a record high number for non-ICU COVID hospital admissions. We need to see those numbers start to come down, and then I am confident we'll be able to move forward safely and prudently with reducing the burden of public health measures. Let me remind you that this is a government that has been criticized from day one for looking at restrictions as a last and limited resort and lifting them as soon as we could. We will lift these restrictions as soon as it is prudent to do so. And I think that starts quite soon. We're not in a position to give you a specific date because, Rick, we are still at the peak of our hospitalizations from COVID for the past 2 years. So we have to do this in a thoughtful way. That's what we will do. And I believe we'll be able to provide a framework for widespread relaxation of public health measures and rules as early as next week, and that the restriction exemption program will be at the top of that list. But we need to, we have one of the many advantages we have is the ability to see what's going on in other parts of the world that hit Omicron before we did. So the United Kingdom, or England at least, and then Ireland, and now Denmark, South Africa, a number of European countries, in addition to the 3 I mentioned, they have, in the last week or so, lifted all or almost all public health measures. So we're going to be able to see what impact that has in those jurisdictions. And that will help to guide our decisions in the next week or so. So I think that's a benefit we have. We can watch our own hospitalization data, but also see the impact of what happens in those jurisdictions. And my hunch right now is you're going to continue to see in those places that were ahead of us on the Omicron curve. I think you're going to see that the wave continues to go down in most cases. Denmark, slightly different situation because they got a new variant coming in on top of Omicron. But even though their case numbers are very high, their hospitalization numbers are manageable, and that's why they've gone to almost eliminating almost all public health measures. So we're keeping an eye on that, but really the key number here is the total number on hospitalizations. We've got to start to see that come down. That's the key thing to watch.